Transverse myelitis thulium is a rare neurological disorder involving inflammation of the spinal cord, often affecting the communication between nerves in the spinal cord and the rest of the body. This inflammation interrupts nerve signals, which can lead to various symptoms, such as pain, muscle weakness, sensory issues, and sometimes paralysis. Causes of transverse myelitis. The exact cause of thulium is often unknown, but it is thought to result from an autoimmune reaction or to occur secondary to other conditions. Potential causes and associated factors include infections, viral or bacterial infections e.g., herpes viruses, Epstein-Barr virus. Lyme disease may trigger an immune response that leads to inflammation in the spinal cord. Autoimmune disorders. Conditions like multiple sclerosis, MS, neuromyelitis optica spectrum disorder and MOSD and sarcoidosis can trigger thulium as part of the immune system attacking the body's own tissues. Post-infectious or para-infectious reaction. Sometimes, thulium can occur after an infection or vaccination, possibly due to an overactive immune response. Other inflammatory conditions, lupus, Sjogren's syndrome, and other autoimmune conditions can lead to inflammation in the spinal cord. Unknown idiopathic. In many cases, the cause remains unclear even after thorough investigation. Symptoms of transverse myelitis. Thulium symptoms can develop suddenly over a few hours or gradually over a few days. Common symptoms include pain, often the first symptom. Pain is usually felt in the lower back and radiates down the legs or arms. Weakness in limbs. Muscle weakness can vary in severity, sometimes leading to complete paralysis in severe cases. Sensory changes. Numbness, tingling, burning, or cold sensations are common, and some individuals experience heightened sensitivity to touch, heat, or cold. Bladder and bowel dysfunction. Many people with thulium have urinary retention, difficulty urinating, or incontinence, as well as issues with bowel control. Spasticity, muscle stiffness or spasms can affect movement and coordination. Symptoms vary depending on which section of the spinal cord is affected and the severity of inflammation. For instance, inflammation in the thoracic spine mid-back is most common and may lead to lower body symptoms, whereas cervical spine involvement neck area can affect both the arms and legs. Diagnosis. Transverse myelitis is diagnosed based on clinical symptoms, imaging, and laboratory tests. These may include MRI magnetic resonance imaging. MRI scans of the spine and sometimes the brain can reveal inflammation or lesions on the spinal cord, which are essential for diagnosis. Lumbar puncture. Spinal tap. A sample of cerebrospinal fluid (CSF) is taken to check for inflammation, infection, and immune system activity. Blood tests. Blood tests may help identify autoimmune markers, infections, or other conditions associated with thulium, such as NMOSD or MS. Treatment and management of transverse myelitis. The treatment approach for thulium focuses on managing inflammation, relieving symptoms, and aiding recovery. Common treatments include corticosteroids. High-dose intravenous corticosteroids like methylprednisolone are typically given to reduce spinal cord inflammation. Plasma exchange plex. For patients who don't respond well to steroids, plasma exchange can be used to remove potentially harmful antibodies from the blood. Intravenous immunoglobulin (IVIG). This therapy may help modulate immune response in some cases. Pain management. Medications, such as anticonvulsants e.g., gabapentin, or antidepressants e.g., amitriptyline may help relieve nerve pain. Physical therapy and rehabilitation. Physical therapy is crucial for helping patients regain strength, mobility, and functional skills. Occupational therapy and mobility aids may also assist those with longer-term symptoms. Bladder and bowel management. Depending on symptoms, strategies such as timed voiding, catheterization, and dietary changes can help with bladder and bowel control. Recovery and prognosis. The recovery from transverse myelitis is highly variable and can take weeks to months, sometimes up to 2 years. Approximately one-third of individuals experience significant recovery, one-third have moderate lingering symptoms, and the remaining one-third may experience more severe and permanent impairments. Factors influencing recovery include the rapidity of symptom onset. Sudden onset is generally more severe. Early intervention and treatment response. The severity of symptoms at their peak. Complications and long-term management. For those with lasting symptoms, complications can include chronic pain. Nerve pain can persist even after inflammation subsides. Mobility challenges. Muscle weakness or paralysis may lead to difficulty with walking or other movements, sometimes requiring assisted devices. Bladder and bowel dysfunction. These issues can persist and may need long-term management strategies. Supportive measures, such as physical therapy, counseling, and support groups, can help individuals cope with lasting effects on physical and emotional health. Outlook. Transverse myelitis is a serious condition with potential for significant impact on quality of life. However, with early diagnosis and treatment, many people experience considerable recovery, and ongoing rehabilitation can further improve outcomes. Regular follow-ups with healthcare providers, especially neurologists, can help monitor and manage the condition over time.